Thank you, Mr. Speaker. This question is for the Premier. Speaker, as Ontarians are watching the developments around the COVID-19 pandemic unfold, there is understandably growing concern among parents and guardians about protections for our kids in our school system. While so far the virus has had very limited impact on children younger than 10, the nature of children's interactions could increase the risk of transmission in schools. Can the Premier tell the House what steps the government is taking to support school boards and families as they deal with the threat of COVID-19?
Minister of Long-Term Care.
Thank you, Speaker, and thank you again for the question. The health and well-being of Ontarians, including students and school staff, is Ontario's top priority. Students, parents, school communities should rest assured that we are working together in close cooperation with partners in both the education and healthcare sectors to ensure the continued safety of students and staff. In the course of case and contact management, public health units can contact employers, schools, restaurants, and places of business, and this is a completely normal part of Ontario's response to COVID-19, and it means our system is working. Our government will continue to keep school boards up to date on the current situation and work to contain COVID-19. We all have a role to play in this. We all have respect and responsibility for our own health and the health of others. Thank you.
The supplementary question.
Thank you, Mr. Speaker, and thank you to the Minister for that response. I have to say, though, I was hoping we would get a little bit more detail here in the House about what's happening now. What we're hearing is that there are going to be regular calls starting after March break. That is concerning, I think, for a lot of us. We want to know that this is happening now, that there's a plan in place, and that there's complete transparency. School boards are already taking, as we know, extra precautions to guard against outbreaks. Custodians are logging extra hours. Extra cleaning and sanitizing supplies are being ordered. But at a time when we've seen school boards squeezed and custodial staff laid off, the government needs to be prepared to provide resources as necessary. During the H1N1 outbreak, the province provided additional funds to offset these extra costs for boards. Is this government prepared to do the same for COVID-19?
Minister of Education to reply.
Thank you, Speaker, and thank you to the member opposite for the question. I think we all have a shared interest in ensuring the safety of our students and our staff in our schools, Speaker. And that's why on the first case, the presumptive positive case of COVID-19, I asked with the support of the Minister of Health and Deputy Premier, to get the Chief Medical Health Officer to speak to every Director of Education on the Sunday, the day after of that first case. Information is flowing in real time. We have constant dialogue with directors and our stakeholders within the system to ensure staff and students remain safe. Of course, Speaker, we have increased a heightened vigilance in schools to ensure the safety of our personnel. The government, federal government as well, has provided guidelines surrounding best practices to keep safe. We are obviously going to continue to have those discussions in real time with the Directors of Education in consultation with the Chief Medical Health Officer to ensure that every student, every staff member in Ontario remains safe.